We will now move directly into session 1, which is entitled A Future for the World's Children. And that session will introduce WHO-UNICEF-Lancet Commission's recent call for a new global movement to place children at the center of the Sustainable Development Goals and change the way we work on child health in the context of climate change. At this time, I want to invite one of my inspirations, and members of his staff were telling me that I have to get the pronunciation of his name correct. So I'll try. Once I introduce him, he will allow me to know if I at least got it 70% correct. At this time, I will introduce to you Dr. Alois Kamura-Guillet, representative of UNICEF Eastern Caribbean Office. Dr. Alois, please tell me I got it correct.
Yeah, it's perfect, Ashley.
Fantastic. Over to you, sir.
Thank you. Greetings to all. In the interest of time, we have to catch up a little bit with 5 minutes of delay. I'm gonna directly hand over to the 2 experts first that will be presenting. It's a challenge because they just have 4 or 5 minutes each. So the first one is my colleague from the Eastern Caribbean, Dr. Karen Paulson, advisor on climate change and environmental determinants of health at PAHO, the Pan American Health Organization. And the second presenter expert is Dr. Nick Watts, Executive Director at Lancet Countdown. We are privileged also to have the testimony by Licypriya Kangujam from India. She is one of the youngest climate activists in the world. So we are very happy to have her with us. So over to you, Dr. Karen.
Thank you very much, Alois, and good morning all, and thank you for this exciting opportunity to engage with you for a few minutes. It is said that climate change is the biggest global health threat of the 21st century. Climate change presents several risks to health due to direct and indirect impacts resulting from extreme weather events, increased transmission of certain infectious diseases, disruption of health services, and displacement of populations. The World Health Organization projects that an additional 250,000 deaths per year between 2030 and 2050 will be attributed to climate change. In the words of Dr. Tedros Ghebreyesus, Director General of the World Health Organization, and I quote, "Climate change is not only racking up a bill for future generations to pay, it's a price that people are paying for now with their health," end quote. The acknowledgement of the devastating effects of climate change has led to commitments being made at the global level for a unified approach to reduce emissions of greenhouse gases and build or strengthen resilience. The intrinsic link between human life and the environment are highlighted in the Paris Agreement, in which the need for protection of people from a future which is increasingly unsafe and uncertain is recognized. The responsibility for health in sustainable development far exceeds the ambit and capacities of the health sector. Therefore, the 2030 Sustainable Development Agenda presents a unique opportunity for the health sector to play a key role in leading by example through engaging multiple stakeholders in other sectors in the decision-making process and developing proposals for solutions. The Caribbean, as a small island developing state, is already experiencing the impacts of climate change and can no longer tackle the many problems associated with climate and health independently. In 2019, the Caribbean Action Plan on Health and Climate Change was launched as part of the WHO's Special Initiative on Climate Change and Health in SIDS. The Caribbean Action Plan aims to protect the health of Caribbean SIDS populations through strategic lines of empowerment, evidence, implementation, and resources. Take note, the youth and climate movement is a powerful global force which is casting light on the problems. To further empower this movement, it will be critical to find mechanisms through which young people can influence levels of governance and policies to position youth leadership as agents of change for health, the environment, and climate change. We live in an era like no other. There is a demographic shift in that the adolescent and youth population is the largest cohort in the history of the Caribbean region, representing 26.6% of the total populace. At the first Caribbean Congress on Adolescent and Youth Health, held in October 2019, young people made an open call for measures that specifically target them and the recognition that they can be agents of change to reduce the impacts of climate change. The Pan American Health Organization, PAHO, in acknowledging the need to involve youths, will be working with other Caribbean agencies to engage and train influential youth leaders in climate change and health advocacy, establish practicums, and develop community projects to further involve you. PAHO recognizes and affirms with the rest of the United Nations team that it is only by working with and involving you, young people, that we will be able to achieve climate resilience and sustainable development, thereby contributing to a better tomorrow. Thank you. Over.
Many thanks, Dr. Karen, for setting the tone, showing the consequences, the impact of the climate change on health in terms of increased mortality, diseases, and especially stressing the role of young people in the change we are looking for. And you have indicated some areas PAHO would expect the young people to be involved, and you are complementing what Mr. Hart has started indicating the five actions. Thank you very much for making the time to join this summit. So now I hand over to Dr. Nick Watts, Executive Director of Lancet Countdown. Over to you, Doctor.
Thank you. Hi, hello. Hey, everyone. Thanks so much for having me here. As you can see, I'm in a dark part of the world up in the United Kingdom. And as you can hear, I'm Australian. So I'm from a small island state as well, just maybe a slightly larger small island state than we might be used to. I want to say thank you. I want to say thank you to UNICEF. I want to say thank you to the World Health Organization. I want to say thank you to Ashley Lashley and the Ashley Lashley Foundation. Climate change is the defining health issue of the 21st century, of our lives. And the people that are the least responsible but have the greatest capacity to do something about it, the youth out there scattered across the world, I don't think we spend nearly enough time talking about how we can do a better job of including them in the solution. But I also don't think we spend nearly enough time talking about the benefits. I think we spend far too much time talking about all of the scary things, all of the negative things that climate change is going to do to our health. I think we need to flip it around and we need to start talking about what the benefits of the solutions look like. Because it turns out that when you go and sit down and look at all of the different things that you want to do to respond to climate change, we've heard of a few of them. If you want to phase out coal-fired power, If you want to move away from cars and polluting vehicles, if you want to shift agricultural emissions from farms and from our food, if you're a doctor, I'm personally, I trained as a doctor. I work mostly in hospitals before I came to this life. If you look at all of those different solutions, they don't look like climate change solutions to you. To me, they just look like sensible public health interventions. They look like things we should be doing anyway, because they're talking about cleaning up our air, making sure that our lungs and our hearts can grow and can breathe properly. We're talking about healthier, more nutritious diets. We're talking about all of the good things that come when we invest in local farmers, in local communities. And we start to see fresher, more seasonable fruit and vegetables. And we're talking about building cities, and we're building communities and houses that are designed around people, that aren't designed around cars, but encourage us to engage in physical activity, that create an environment that we want to live in. And I think we need to spend much more time focusing on those solutions, because it turns out that when you turn around and you look at climate change, it's actually a choice. It's actually really, really simple. I think for too long we've had scientists tell us that, oh, this is very complex and we couldn't possibly understand all the complexity that is there. Thankfully, the scientists have done all of the hard work, and they figured out that actually it's a choice. We have a choice about which world we continue to live in, which world young people grow up in. And on the one hand, we have a world where climate change defines the health of an entire generation, defines all of the negative things, the spread of infectious disease, the extreme events that we expect to see, heat waves and floods and storms. But it doesn't have to be that way. We have that second option. And we could see children growing up today, we could see people going about their lives in a world that has cleaner air, that has healthier diets, that has more livable cities. And I think we need to make that choice. And that's why I'm really excited about the launch of this campaign. That's why I'm really excited about this event, is because, just as I said at the very start, it is those young people that have done the least to contribute to climate change that have the greatest potential to make that choice for us. So that's all I have to say. I know that's a little short, but I must say I would much rather hear and have a discussion and some questions rather than hear from me. So thank you very, very much for having me.
Thank you very much, Dr. Nick, stressing the way of communicating. Your message is really compelling. So the message that we should focus on the positive, not on the negative, show what it means for, if we come up, the world comes up with solution, what it means for our daily life, for the human beings. So I think that's a powerful message that all participants will take away, focusing on solutions, local solutions. That definitely critical. So let's now hand over to Licypriya Kangujam. I'm not sure that I'm pronouncing very well your name, Licypriya. Thanks a lot for joining. Over to you for your testimony.
Thank you. So, hi everyone. My name is Licypriya Kangujam. I'm 8 years old. I'm an Indian climate activist and the founder of the Child Movement. Thank you so much, UNICEF, Ashley Foundation, and Children Environmental Rights Initiative for inviting me here to speak in this program. Coronavirus is the testing time for our leaders and human beings. 2020 is a very crucial year to decide the future of our planet. But due to this spirits, I had to cancel lots of my planned schedules, events, programs, activities, campaigns.
Okay, so from today, we are not uttering any word on brand ambassadors, okay?
No.
Yeah, please, can you all mute your mics, please? Go ahead, Licypriya.
Okay. So 2020 is a very crucial year to decide the future of our planet. But due to this COVID-19, it weakened our movement but not our spirits. I had to cancel lots of my planet schedules, events, programs, activities, campaign, etc. But I still continue to plant trees nearby roads, places to my home. It's really hard to manage these lockdowns. People always tell me that you are too young to get involved in such activism, but I prove them that it doesn't matter to make a difference. And big or small, it doesn't matter. I am a girl child. I'm strong, I'm smart, I'm intelligent, I'm brave. Many children and youth inspire from me. You can just see in Delhi how air pollution is so dangerous and even children can't move out of the home. I'm worried about the health of the school children and small babies. Government announced that there would be holidays for 3 days, 5 days, 10 days, but this is not the solution. Our leaders are just busy in blaming each other instead of finding a long-term solution. They are just telling the speech, they are not doing any action. I want our world leaders to do more action, otherwise our future and our planet would be dying soon. They must act now to save our planet and our future. And you can just see in Arctic and Himalayas how icebergs are melting twice as fast than ever before, and how sea level are increasing, and the earth is becoming very hot. I'm worried about the future of our planet, and many biodiversity hotspots become climate hotspots now. I think you all know about Australia bushfire. More than 1 billion animals has died, millions of trees has gone. I'm really very sad. I couldn't sleep. I couldn't even take my food. Many children lost their homes, but this is the real effect of climate change. Our leaders don't have time to listen to us. Why they don't hear all our voice? But this is the real climate emergency. They must act now to save our planet and our future. All these problems facing by our own generation, especially children of the world, including myself, made us to think, to realize, to work, to fight, to save our planet for our future. That's why I'm planting trees, fighting with our leaders, protecting our environment, etc. And I even became a vegetarian. My family now became a single-use free plastic family, including my neighbors and families and my friends in schools. And also we start sustainable consumption, stop wasting food, and we can transform from a non-veg family to a vegetarian family. This itself a big change in our community. When I see at an Indian or American or European climate activist, there is no difference in our capacity to fight the climate change. But our issue is different. India is more vulnerable than those European countries and America. You can just see, India is facing currently flood, drought, heat waves, cyclones, earthquake, heat waves, etc. at the same time. So the world must pay equal attention to our voice. And after that, we can bring a transformational change in our country. Today, I want to share something with everyone living in this world from my little heart. We all know we are facing a pandemic on one side and flood, drought, heat wave, cyclone, etc. on another side. Now, this is the time to wake up. This is the time to open up your eyes. This is the time to send your children and grandchildren to fight for the survival and for their own future. The best gift parents can give to their children is not a beautiful house, expensive cars, lots of money. The best gift you can give to your children is a beautiful planet. To give this planet, you have to empower yourself. If you can empower yourself, then you can empower your family. If you can empower your family, then you can empower your neighborhood. If you can empower your neighborhood, then you can empower your community. If you can empower your community, then you can empower your state. If you can empower your state, then you can empower your country. If you can empower your country, then you can empower the whole world. Empowerment means independent. Independent means freedom. Freedom is when you can protect your land and environment. Freedom is when you can protect your children's future, culture, and health. Freedom is when no one can discriminate you on the basis of caste, creed, color, sex, or any other differences. Freedom is when you can read and write. Freedom is when you are out of hunger. Freedom is when we are all together in this fight. Fight for your freedom. Thank you, Jai Hind, Sanaliba Manipurna Yafik. Thank you once again.
Thank you so much. Thank you so much.
Welcome.
Thank you so much. Very powerful message. I think you are very clear.
Thank you.
It is very clear. The best gift we have got to give to our children, grandchildren, is a safe planet, a beautiful planet. And to do so, we need to empower all people, starting by the family, the community, the countries. That's great. So imagine that across all the regions, countries, we had children like her. She's just 8 years old, and she's committed to make the difference. That's why we say that really there is hope. There is really hope to make the difference. And of course, Dr. Nick, to roll out, to implement all the solutions you have advocated for. So let me just allow a few minutes, let's say 2-3 minutes for questions and answers. At least one question. Yeah, you know, Licypriya, I was looking at the chat box. Everybody was cheerful, saying that you are very smart, you are the best. Keep doing the work, advocacy you are making around you.